Good evening and welcome, dear viewers, to this FB Live by Apollo CBCC Cancer Hospitals. I hope you are doing well. Today, we are going to talk about ovarian cancer and the ways we can find the condition. That's why, for today's talk, HIPEC newer techniques for treatment of ovarian cancers. Apollo CBCC Ahmedabad's senior consultant oncosurgery, Dr. Nitin Singhal, will be joining us to discuss the latest techniques and therapies for treatment. A little background on Dr. Speaker. Dr. Singhal completed his MBBS from a reputed government medical college in Nagpur. Soon after that, he completed his MCH, surgical oncology, along with a comprehensive 3 years training program in oncosurgery from one of the world's most prestigious institutes, the Tata Memorial Hospital, Mumbai. He later spent a year at Tata Memorial Hospital to further fine-tune his skills as a surgeon and was the youngest surgeon ever to achieve this qualification from TMH Mumbai. Thank you very much, Doctor, for joining us today.
Thank you, Ananda.
All right, sir. So we'll quickly start this session. So my first question would be, what are gynecological cancers?
As the name suggests, it's a broad term. Gynecological cancers basically means all the cancers which pertain to the genitourinary tract of a female. So, basically, it encompasses as a term all the cancers which are relevant to the ovary, the uterus, that is the womb, or the cancers which are related to the mouth of the womb, that is the cervix, or the cancers which are related to the vagina and the fallopian tube. So all these cancers together, they are known as gynecological cancers.
Okay, sir. So the second question is, what are commonly observed symptoms, sir?
When we talk about symptoms, actually the symptoms, they depend on the subsite which we are talking about. But in general, if I have to give a broad overview of the symptoms regarding gynecological cancers, then the common symptoms are like for uterine cancer, it will be bleeding, blood coming out through your vagina, just like your periods. But mostly, since these cancers are seen in women who have already completed their menstrual cycles, that is postmenopausal females, and any female who is postmenopausal and having bleeding, just like their periods, even if it's a single episode, it should not be taken lightly. The other common for other subsites like the cancer of cervix, the common symptoms are watery discharge through vagina, bleeding after intercourse. In later stages, patient may complain of backache. And when we are talking about the symptoms generally are more than 2 weeks of duration. Like having a watery discharge, it's a very common symptom which is commonly seen in sexually active females, but not everybody would be having the discharge for more than 2 weeks continuously, and most of them actually would be taking some form of treatment through their gynecologist, and this usually responds. But when this is not responding to the usual conservative treatment, and if it is more than 2 weeks of duration, then it is of a concern. Then coming to cancer of ovary. Now, cancer of ovary, the problem is it's a great mimicker. Now, the problem is most of the symptoms which we see in ovarian cancers, 70 to 80% of the times, the symptoms are usual symptoms which we see in our day-to-day life, like feeling of heaviness in abdomen, feeling of bloating. That is like previously, if somebody used to take one chapati, now two chapatis say, and now even after taking one chapati, somebody feels full. Then that is basically some sort of a worry. And then patients may have complaints of distension of abdomen. They may feel some sort of fluid in the abdomen, that is ascites. They may have pain in the lower abdomen or the back, frequent visits to the washrooms, for that is again a symptom. So all these symptoms, if you see, they are generally not directly pointing towards ovarian cancer, but these are all symptoms which are commonly seen in other situations also, and that is one of the reasons that most of the times ovarian cancer is diagnosed late also. But if any female who is more than 30 years of age, more so if she is 40 years of age, and the symptoms are persistent for more than 2 weeks, then they should not ignore the symptoms and should definitely visit the doctors. Now, coming lastly to the stem cancer of vulva, so it is the external genitalia and it is easily accessible for vision. So, any sort of an ulcer, any sort of growth over there, that could be a sign for this sort of a cancer.
Right, sir. So, sir, you just mentioned ovarian cancer. Would you please explain that? What is that?
So, as the name suggests, ovarian cancer means any cancerous growth which is happening in the ovaries. Ovaries are, we have females have two ovaries, and every month there is an ovulation cycle, which I believe everybody knows. And if due to some reason a cancerous cell takes its place in the ovaries and it starts growing uncontrollably, that is out of the control of the normal body system, then it gives rise to a cancer. And most of the times it arises from one of the ovaries, but rarely we also include cancers which arise from a tube, which is a fallopian tube, which is in the connection with the ovary, and cancers arising from this are also clubbed along with the ovarian cancer. So this is what in nutshell I would say is an ovarian cancer.
करेक्ट सर सर सो हु आर एट रिस्क कौन सी फीमेल्स ज़्यादातर इसके रिस्क में होते हैं सर
So, coming to the risk factors of ovarian cancers, so we can basically define the risk factors into two. One is genital, that is familial based risk factors, and the other are non familial based or de novo, that is not related to the family at all. Now, here itself, I'll make it very clear that most of the cancers which we see in day to day life, they're actually de novo and they don't have any familial relation for its origin. And the common risk factors for these are again lifestyle related, like obesity, not having a baby, that is nulliparity. Then patients having the sedentary lifestyle, and then patients who are actually eating a lot of non-vegetarian food. All these are patients that is not controlling the weight. So these are the patients who are at increased risk of ovarian cancer. Then the other set of patients which are basically familial based, that is they have some genetic relation to it. They have some familial syndromes because of which they are at increased risk of ovarian cancer. So common in that is BRCA, which we commonly listen regarding to breast cancer, so BRCA related cancers. And then there are certain other genetic syndromes which we'll not go into details of. So these are the ones who are having increased risk of ovarian cancers. So generally, if somebody is having a history of ovarian cancer in their family, like in their mother or in their grandmother or in their sister, they are at increased risk of having this cancer at some point of their point of time in their life.
correct sir sir the next question is how can it be diagnosed and what are newer techniques for treatment of ovarian cancers
So, diagnosing ovarian cancer, as I just mentioned in the symptomatology, they have very vague symptoms. Almost 80% of the ovarian cancers patients, when they come to us, they're already in stage 3 C, 3 or 3C. So, that is already it is beyond the ovaries and has spread into the upper abdomen. And that is because of the fact that this cancers, they generally in the initial stages, most of the patients, they don't have any particular symptoms, and that is where people keep ignoring it. As we discussed during the symptomatology, having feeling of fullness, that is a very common day-to-day phenomenon, and people just ignore it, and that is the reason that they are diagnosed late. But few lucky ones, those who have symptoms like pelvic pain, those who have some other like frequent micturition, and they go to doctor for checkup, and then they are diagnosed early while doing the investigation. That is generally when the patients come with the symptoms, the doctors orders certain radiological investigations, generally which is in the form of a ultrasound to start with, and in which if the mass is found, then they are diagnosed early. But otherwise, if the patients, they have this symptoms which are non-specific one, and when they are diagnosed, they are usually diagnosed late, and at that time, most of the times, already there is some fluid in the abdomen, that is ascites. And when the patient comes to us, we do CT scan, we find that disease is present at multiple places. Then we do biopsies, or we do take out some amount of this fluid and send it for biopsy, and that is how we come to know about the diagnosis of this ovarian cancer.
So, sir, when we are talking about the treatment, what is HIPEC?
So before I go to HIPEC, let's understand the treatment of ovarian cancer in general. So when ovarian cancer, generally it's a disease in which surgery as well as chemotherapy, they both play a significant role, and I can say none of them can be excluded. Without one other cannot do the needful for a patient. So they go hand in hand, surgery as well as chemotherapy. So when we talk about HIPEC it's a novel form of therapy, and HIPEC is an acronym which stands for hyperthermic intraperitoneal chemotherapy. So HIPEC itself is not a surgery. So HIPEC is basically a procedure which is done during the time of surgery, which is done for a ovarian cancer.
Right, sir, right. Right. So, sir, what are the benefits of HIPEC?
So, before I go into the benefits of HIPEC, let me explain a bit about the surgery which we do for ovarian cancer. So, when generally, traditionally, the surgery for ovarian cancer used it's meant to be like removing the uterus, ovaries, and there was a fatty layer called omental, some biopsies from there. That is what the traditional surgery, which was also known as debulking surgery, that is what was the considered as the standard treatment. But as we have understood the biology and the technological advances have happened, now we understand that for ovarian cancer good long term outcomes, we need to do an aggressive surgery, which is in a cytoreductive surgery, which is much more than the traditional surgery which we do for ovarian cancer. So in this, we remove whatever the disease portion, that is the uterus, ovary, even the peritoneum, which is the lining which covers the organs inside the abdominal cavity, where many times this cancer cells they reside, that needs to be removed. Along with that, we need to clear the lymph nodes wherein the cancer spread, and along with that, sometimes a part of the intestine or stomach may also need to be removed to ensure that there is no visible disease inside the abdomen at the end of the surgery. And this form of aggressive surgery is known as cytoreductive surgery. And at the end of this surgery, when then we subject the patient to a therapy. If we are doing HIPEC, then we subject the patient to additional therapy, that is a heated chemotherapy. That is, we circulate the chemotherapy inside the abdomen, and this heated chemotherapy, which is done for variable time depending on the indication, from 30 minutes to 90 minutes. So basically this chemotherapy, it helps in killing the microscopic cancer cells which are not visible to the naked eye, and at the same setting of the surgery, it helps in achieving a better tumor kill, because that microscopic cancer cells which are left over after the surgery, they may be trapped in the adhesions which are formed after the surgery. So HIPEC basically ensures that all these cancer cells are killed during that, at the same time of the surgery. Now coming to what are the added advantages of the HIPEC. Now HIPEC, as I told you, it's a heated chemotherapy. So the cancer cells, after being treated with surgery, as I said, told the cancer cells are micro cancer cells which are trapped inside the adhesions, they are killed. But in addition to the effect of the chemotherapy, the heat also helps in direct killing of the tumor cells. Additionally, this HIPEC therapy, it enables to give a large, or I would say a concentrated form of chemotherapy to the site where exactly it is supposed to be meant to be. Like normally when we give IV chemotherapy, the amount of drug which reaches the peritoneum, it may not be that substantial because of the various reasons, because the cancer cells, they don't have that much of vascularity. So if we are trying to give more chemotherapy via IV route, then obviously it will lead to more of more of side effects of the chemotherapy. So HIPEC basically helps in a way that it kills the tumor cells exactly at the site where it is meant to be, and avoiding a significant systemic side effects. And also it helps in overcoming cancer cell this chemo resistance in certain tumors which are said to be chemo resistant under the effect of heat, and this specific chemotherapies which are more active intraperitoneally, that is in the abdomen, this chemo resistance is also taken care of. So these are the advantages of HIPEC.
राइट सर सर सो अभी आप बात कर रहे थे कीमोथेरापी की सो आई वुड लाइक टू आस्क यू वन मोर क्वेश्चन अबाउट इट हाउ इज हाइपेक डिफरेंट फ्रॉम ट्रेडिशनल कीमोथेरापी
So traditional chemotherapy, as we all know, it is a form of drugs which are given through the intravenous route. either directly in your hands, or if we are giving it through chemoport, which is placed in your chest, that is how we give the chemotherapy, that is directly into the vein. And there are multiple sessions. It is not like a single session that the chemotherapy is over. There are multiple sessions, and depending on the various protocols used, it may be once in 2 weeks, once in 3 weeks. That is how a chemotherapy works. And the chemotherapy, the IV chemotherapy which we give, generally it works on the principle of hitting the cells which are actively dividing, and the cancer cells, because they're rapidly progressing, that is how it is hoped that the chemotherapy will go and hit on those cancer cells. But in the bargain, many other cells in the body which are actively dividing, like the cells in the mucosa, they get hit by this thing, like our hair cells, and that is why we lose hair during chemotherapy. We have a lot of mucositis, that is ulcers in the mouth, because of this chemotherapy. And again, this chemotherapy, it does not have a distribution. It will go all across the body in a uniform manner as much as possible, depending on the vascularity of that organ. Now, when we talk about HIPEC, HIPEC is a localized form of chemotherapy in a manner that it is generally localized to the abdomen, where we are targeting the cancer cells. It does not, or I should say, very little amount of it goes to the systemic thing, because of the certain advantages, the pharmacokinetics, that is the technical advantages which we have, that the drug does not crosses the barrier. There's a barrier in the body, and it gets confined into the abdomen, thereby sparing rest of the body organs from a significant side effects. I don't mean to say that there will be no systemic side effect, but the extent of systemic side effect would be much lesser than compared to the traditional chemotherapy of the same dose. Also, HIPEC, again, as I said previously, it uses advantage of heat as well as chemotherapy. So there is a dual kill of the cancers, not only with chemotherapy but with heat also. Thirdly, it is a single session. We apply. It's done at the time of surgery. It is not a multiple session. Fourth, it is done exactly at the end of the surgery, when already we have removed the major chunk of the tumor, so that the chances of hitting the tumor, whatever micro cancer is left, the chance of hitting the tumor are much higher with a HIPEC. So that is how a HIPEC differs from a traditional chemotherapy.
Correct, sir. So what cancers can be treated by HIPEC?
So HIPEC is generally used to treat any type of cancer which are of a peritoneal origin. So how do we classify these tumors? So this can be cancers which directly originate in the peritoneum. So these are some uncommon tumors like pseudomyxoma peritonei and mesotheliomas. So wherein the cancer directly arises from this lining, that is a peritoneum lining. Apart from this, certain cancers which generally are confined to abdomen, and they don't spread beyond till very late stages. So, and if they spread to peritoneum, so in that HIPEC can be used. Examples are ovarian cancers, certain colorectal cancers, certain stomach cancers. So these are the few more common cancers wherein which we can use the principles of HIPEC along with cytoreductive surgery.
All right, sir. So what is the recovery like after HIPEC?
So recovery, see, as we discussed, HIPEC is a very major surgery. In fact, many people call it mother of all cancer surgeries. So as you can understand, it's a very major surgery. It takes around 10 to 12 hours to do a good cytoreduction in HIPEC. So obviously and we remove a lot of things from the abdomen. So the recovery, it's going to take some time. But as the knowledge has advanced and we have got better facilities, both in terms of surgical and the post-operative ICU care, the recovery has become much, much smoother than the previous eras. And now I can confidently say most of the patients, they generally they recover decently well. And most of my patients, they are generally in the ICU for 24 to 36 hours after the surgery. After that, they are supposed to be in the hospital for another week or so, during which time they gradually start eating orally. And then after that, they are at home and they need to come periodically to the OPDs once in a week or something like that. And so complete recovery, coming back to almost normal, it takes about 4 to 6 weeks. So, but the I would say first 1 week, that is after surgery, and more so in the first 2 days after the surgery, those are the critical times. And if handled properly and the body is good enough to handle that stress, then mostly we don't face any significant problems.
All right, sir. Sir, so when we are talking about HIPEC, I would like to know what is the success rate of HIPEC surgery?
So success rate again. How do we quantify success? That will be a question, because like, see, if somebody says, okay, after doing HIPEC, would the cancer never come back, then that is a false claim. The success of HIPEC again depends on the extent of the disease and the type of cancer we are dealing with. Like certain cancers, mucinous cancers of appendix, which are slow growing tumors on which our conventional chemotherapy does not respond, and patients may present with large amount of disease in the abdomen, which previously would have been thought of as an curable disease, excuse me. But now, with the advent of HIPEC, in this sort of patients, certain patients may have a very very good outcome, that they may live for many years together. Some may even live more than 10 years also, and may get cured of it also. But at the same time, certain aggressive cancers, like say gastric cancer, stomach cancer, if that is having peritoneal metastasis for which we are using HIPEC, then we cannot expect the same sort of outcome in a patient with a stomach cancer with a peritoneal metastasis. The patient will definitely get some benefit out of HIPEC compared to the conventional surgery, but it is not going to be of the same extent as that we discussed for a patient with, say, a mucinous cancer of appendix. So that is what we need to take into account when we discuss success in terms of HIPEC surgery, and it again depends from patient to patient, type of disease and extent of disease.
Okay, sir. So we are done with our questions, but we do have your questions. May I please have the viewer questions on screen? So Janvi Singh is asking, can cancer come back after HIPEC surgery?
So as I just said in the last thing, yes, cancer can come back after HIPEC surgery. So like any other cancer surgery, HIPEC is never 100% thing that the cancer will not come back. So it will depend for what indication have we used HIPEC, and what was the biology and the disease extent that HIPEC will benefit you. So for certain patients, after doing HIPEC, the cancer may never come back. Like example, low-grade mucinous cancers of appendix, some mesotheliomas. So in ovarian cancers, patient may have relatively longer disease-free survival and overall survival after going HIPEC, which is much significant than the conventional way of treatment.
Thank you, sir. So Sonam is asking, who is a good candidate for HIPEC?
So while choosing patients for HIPEC, we need to take into account two things. One is disease-related things, and the second is the patient's general condition. So if the patient is having a disease which is very aggressive, and by giving HIPEC, I'm not going to add anything significant to his or her life, then obviously that patient is not a good candidate for HIPEC. So we need to take into account the biology and the extent of disease while we decide the patient for HIPEC. Sometimes a patient may be having a very extensive disease, like say in common layman terms, people say 18 kilo tumor tha uske पेट के अंदर, but uska surgery किया. But somebody else might be having a tumor which would be much lesser, say less than 500 gram, but still I might not offer him a HIPEC. So it depends on the type of tumor and what is the biology, what is the histology of the tumor. Along with that, we need to take into account the general condition of the patient. If a patient is not fit enough to undergo this procedure, like very elderly patient, although the general cutoff is 65 to 70 years, but if the patient is like 50 also, but if he's not fit enough to undergo a HIPEC surgery, we don't offer that patient HIPEC. Then other general conditions, because you need a good cardiovascular status and you need decently okay nutritional status. I'm not saying the patient needs to be very healthy, but it should be healthy enough to tolerate that surgery. So that are the patients from whom we can offer HIPEC.
Okay, sir. Samuel is asking, how does one feel after HIPEC surgery?
How does one feel after HIPEC surgery? For that, you'll need to talk to one of my patients, man. I think this is a wrong question for me. How one feel after HIPEC surgery? If you're asking like recovery after HIPEC surgery, we have already discussed. Yes, it takes time after recovering from HIPEC surgery. It's a supra major surgery. It does take toll on your body, but with proper guidance and proper following of advice, you can have a good outcome after HIPEC surgery. And most of the patient after 4 to 6 weeks of surgery, they are back to almost their normal lives.
All right, Samuel, here you go. Mr. Akhil Dave is asking endometriosis leads to ovarian cancer. Is it correct?
So, not all endometriosis leads to ovarian cancer. That is how I would put it. Majority of the endometriosis will not do it. Long-standing endometriosis can, yes, is a risk factor for a ovarian cancer, which is a different variant of an ovarian cancer.
Thank you, Akhilji. Jay is asking approximately how long HIPEC surgery takes.
So again, it depends on how much is the disease load in the body and what all organs are involved. So HIPEC surgery, HIPEC per se, as I told, it's a separate entity that is giving chemotherapy. The duration for which is around 30 minutes to 120, 30 minutes to 90 minutes. That is actually not the major time taking procedure. The major time taking procedure is the cytoreductive surgery, which precedes the HIPEC, wherein we need supposed to remove all the major visible tumor, because before if we don't do that, there's no point doing a HIPEC. So doing that cytoreductive surgery takes time, and it can vary anything between 5 to 6 hours to 10 to 12 hours, depending on how much is the disease burden and what all organs are involved.
Thank you, Jay. Maniji is asking recurrence possible in ovarian cancer post RT.
Post RT. So Maniji, generally we don't give radiation to ovarian cancer patients. So this question of recurrence possible after radiation in ovarian cancer is not a relevant question.
Okay, next question, please. Harsh Bhavsar is asking, is HIPEC used for diseases other than cancer?
As HIPEC, I had initially said, HIPEC is basically hyperthermic intraperitoneal chemotherapy. So chemotherapy is meant for using for cancers only. So HIPEC per se is only meant for cancers, and that too selective cancer. It is not a thing which can be used for any cancer you think of. It is for very selective cancers.
All right, sir. So, sir, we are done with our viewer questions as well. But I would like to tell our viewers, if you have any questions and concerns regarding ovarian cancer and other cancers as well, you please mention your question in the comment box, and we'll get back to you on this. Sir, thank you so very much. It was a very lovely session. Thank you so much, sir.
Thank you.
Thank you.